State-of-the-art medical devices are helping people live longer and healthier, thanks in part to some major research taking place at the University of Minnesota.
Some good work being done there, and right now the largest medical device conference is taking place at the U, and that's where some of the brightest minds are coming together to develop some of these new technologies. Joining us now from Minneapolis is Dr. Rob Sweet. He's from the University of Minnesota Medical School. Nice to have you with us, Dr. Sweet.
Thank you, Tom and Alex. It's nice to be here.
You bet. Now, we know this is the largest medical device conference in the world, so tell us about what's happening right now, what people can expect.
Well, this is a place where physicians, engineers, and industry can come together and share their ideas about how to move medicine forward in the future.
Okay, so if you can explain to us what some of the more common medical devices that you're going to display there and how they work.
Sure. Yeah, what I'm going to show you today is really an ecosystem of models that we've created here in collaboration with MyLab SimPortal and the Medical Device Center here at the University of Minnesota. This is an example of how when you bring physicians together, engineers, and industry, how we can start really pushing things forward. The first thing I'm going to show you here is a model of an individual's face that we can actually use a table to interact with and communicate with each other. And so you can see here I'm actually going to zoom in and actually travel right through this model's mouth, and I'm able to explore that. It's a way that we can communicate with each other and even test some devices. A model just like this can then be used and integrated into an actual simulator. Here's an example of a project we have with the Army Research Laboratory, where we're building and integrating sensors into the model. So as you can see here, if you look on the side, when a person's going to intubate someone in order to place an airway to help them breathe, either before a procedure or emergently, this is a model that was created from that digital model. And we can actually sense the forces that are being applied. And if for someone who's learning a procedure like that, it gives them feedback that a regular mannequin wouldn't be able to, which is how much force are they applying and where are they applying it. And that's integrated into a full system right here. So we're in a phase 2 right now with the Army Research Laboratory with plans to license this out or go commercial. This is a full mannequin that will be going through testing for just those procedures. And another one I wanted to show here is actually a good example of collaboration between the University of Minnesota and local industry. American Medical Systems is a local company here that builds a leading prostate laser procedure. So the same type of process you saw here, we integrated into basically the equivalent of a flight simulator to train surgeons. There's over 130 of these deployed worldwide right now that are training surgeons to be safe before they operate on their first patients.
Yeah, we're just about out of time here, Dr. Sweet. It's just incredible to see some of this. Much of this relies on new technology, so what new innovations are researchers currently working on?
I think some of the key things are modeling and advancing the models, both from a physical standpoint and also how do tissues interact. That's a very difficult, challenging problem that together with engineers and physicians we can solve.
Yeah.
Okay.
Just incredible stuff.
Really, the future is when you think about in health terms in the medical development world, it's just fascinating to watch.
And it's here right now at the University of Minnesota. Thanks
That's right.
So much.
Good point. It's here. Dr. Rob Sweet from the U of M. Thanks for joining us this morning.
Thank you.
You bet. Yeah. Wow. Way over our pay grade. That's for sure.
Certainly.
Yeah.